In Class 5, we reviewed the 3 remaining principles of the ASHA Code of Ethics. Principle 2 addresses achieving and maintaining our competence in all that we do. While you might feel this principle should be obvious, sometimes life situations, like having 3 children, a spouse, caring for an elder patient, and working part-time, can significantly diminish your time and energy toward keeping up with the latest developments. Since the Code of Ethics was last revised in 2003, ASHA has mandated a prescribed number of continuing education credits be completed on a triennial basis in order to maintain certification, recognizing the need to keep current. Members need to maintain and provide appropriate documentation having completed the required continuing education hours every 3 years. You will notice the recent increase in companies, organizations, and associations now providing CEU seminars to meet the demand of ASHA members. Behaviors exemplary of upholding professional competence include the following: only providing services holding your certificate of clinical competence, only providing services within the scope of practice that you are capable and competent to do, continuing your professional education, delegating duties and responsibilities for clinical services appropriately and only to competent individuals, not requiring or permitting supervisees to perform duties beyond their competence, making sure that equipment is in the best working condition so that accurate measurements will result. Principle 3 outlines our obligations interacting with the public. Recall that the public has granted SLPs a monopoly, the exclusive right, to provide services to communicatively impaired individuals through issuing the state SLP license and teaching certification. With this privilege comes a responsibility to provide services, conduct research, and behave professionally and in an ethical manner. As part of the SLP's responsibility in dealing with the public, we make commitments to not misrepresent our credentials or role within the fields of healthcare and education, not participate in situations in which there is a conflict of interest or the perception of a conflict of interest, to refer patients to other services exclusively on the basis of their interest without consideration of financial gain or other benefits or advantages for ourselves, not to misrepresent clinically related or research information or act to defraud any person or business, to provide only accurate and complete information about all aspects of the profession and professional knowledge, and finally, that all information provided to the public in marketing and all other endeavors should adhere to the prevailing standards. These are our professional obligations to the public we serve. Finally, Principle 4 addresses our interactions with workers in our own profession and in other professions. The Code of Ethics guidelines include keeping other SLPs from violating the Code of Ethics, not engaging in conduct that reflects badly on the profession, refraining from sexual activities with students, clients, and subjects, attributing credit for work done in an honest and appropriate way, making statements to others about professional information that is accurate and reflects prevailing professional standards, acknowledging and referencing the work of others, their ideas, research, and the like. Professional services should be provided solely on the basis of the professional's judgment and not be influenced by other sources such as administrators or physicians, for example. Professionals are not to discriminate in their interactions with others based on protected classes. There is an obligation to report ethical violations to the Board of Ethics. And finally, members of ASHA must comply with the policies of the Code of Ethics and comply with the decisions of the Board of Ethics. Again, let me stress, for a deeper understanding and real-life examples of these rules of ethics, please refer to the annotated Code of Ethics available to you on the website. The preamble to the Code of Ethics also states that the principles and rules included in the code are not meant to be a complete inventory of ethical behaviors, but only to form a foundation of what is considered essential for ethical practice. Thus, ASHA's Code of Ethics provides a framework for speech-language pathologists and audiologists and tries to establish a mindset for behaving appropriately through its principles and rules. From this document, speech-language pathologists should develop the understanding of the elements of doing the right thing professionally.